I woke up early to work on my paper, and I noticed that my 2 fingers were numb. And I didn't really think anything of it at first because I always sleep on my hands, so sometimes when I wake up, my limbs are just kind of buzzing.
Michelle Jones, a graduate student at Wayne State University, didn't realize she was experiencing the onset of a mild stroke. Several days passed before she was sure something was wrong.
While we were sitting in the kitchen eating, I felt really strange. It was like my brain skipped a beat. I was trying to talk, and I could talk, but my, kind of like my mental flow wasn't like it normally is, and it's like I skipped a beat. And I was like, I just started slamming on the table. It's like, take me right now because I know something is wrong.
And so, Michelle was taken to one of the best medical emergency departments in the country, the DMC's Detroit Receiving Hospital. She was suffering a stroke. A blocked artery in her brain was preventing normal blood flow. Enter Dr. Andrew Xavier, whose specialty is the treatment of blood vessel problems in the brain using minimally invasive procedures.
We are able to access the blood vessels of the brain using catheters introduced usually in the groin or sometimes through the arm. We're able to snake it up, get access to the brain. Once we get access to the brain, we perform a series of different type of procedures that would treat a number of different diseases,
including acute stroke. Interventional neurologists like Dr. Xavier have been able to remove clots, seal bleeding aneurysms, and reopen clogged arteries in the brain, all through a small puncture in the groin or arm. Michelle Jones, as it turned out, not only had a blockage in one of the blood vessels in her brain, but an aneurysm too. That's a condition in which the walls of the artery become weak and susceptible to rupture. She was faced with the high risk of suffering more strokes in the future.
It was really terrifying because I guess just the way I think and knowing what I know about strokes, because I had friends and my mom, being paralyzed by a stroke.
In Michelle's case, Dr. Xavier placed a stent in the constricted artery to hold it open, and he addressed the aneurysm to reduce the chance of rupture.
Is it difficult to maneuver through the vascular system once you get into the brain to make this happen?
It is. I think that it needs very specialized skills to be able to take, there are multiple loops the blood vessel takes before it enters the brain. And I think it needs, I would say, specialized training to develop the skill sets to make it happen.
Michelle's recovery was good, with little or no pain.
Dr. Xavier and everyone, they just took really good care of me here.
And today, Michelle enjoys a better quality of life thanks to the cutting-edge procedures offered at the Detroit Medical Center through interventional neurology.
I think we are leaders in the Michigan area, and I think we are a handful of centers around the world that is using everything at its disposal to take care of these very critically challenged patients.
If you had to have this type of procedure, then Detroit Medical Center is a good place to be. Here they deal with all types of people and all types of situations, so the idea of you thinking outside the box, I think they do that very well. And the care that you get here is top-notch.
Visit us here at dmc.org for more information about minimally invasive stroke and aneurysm treatment, or to schedule an appointment with Dr. Andrew Xavier. The DMC. We just think it's a better way to get better. I'm Emery King.